Morning. So we'll start our last portion of epidemiology, the experimental studies. So experimental studies is explained under the following headings. That's introduction, a brief history of experimental studies, then steps in randomized controlled trials, and drawing up a protocol, selecting reference and experimental population, randomization, which is the main step in randomized controlled trials, manipulation or intervention, then follow-up and assessment of outcome. And the next portion is types of RCT that will be covered in the next session. So coming to introduction, that is, I will like to introduce a new term that is called as evidence-based medicine. For you undergraduates, this will be a new term. So when you're going for a post-graduation, you will be familiar with these terms again and again. That is evidence-based medicine or evidence-based dentistry when it comes to our specialty. So what is evidence-based medicine? It's nothing but when we are going to prove something, or we are going to prove an etiology, or when we are introducing a new drug, vaccine, or any treatment procedure. That procedure or that drug has to go through all these epidemiological methods. And the final method and the final confirmatory method is what we call your randomized control trials, experimental studies. So again, there are another few steps, the collection of some experimental studies that is called as systematic review, collection of your experimental studies along with your statistics that is called as meta-analysis. That's a little more further things which is not needed for you now. So the next thing is hypothesis test. Hypothesis testing research studies are those where the research tests the hypothesis of causal relationship between variables. You might have heard this in descriptive studies. The final and the final portion or the last portion of the descriptive studies, we discuss something about hypothesis. So the final hypothesis testing will be written in this particular step, that is randomized control trials. So there we have, for all studies, it is not possible to test through a randomized control trial. So some studies, some particular things like etiologies and all, we will stop in either in case control studies or cohort studies. What are the characteristics? Experimental research is defined as observations under controlled conditions. This is what is the main thing which I would like to discuss here. When you see this randomized control trials, you will see the control as a second control. So that control is not the control which we saw in case control studies. This is something as the control, the full control is with the examiner or the researcher. So he can control the entire thing. What to give, which medicine to give, how much dose to give that particular patient or particular study participants. That can be controlled by the examiner, unlike in your case control in cohort studies. There, nobody has control. All things has happened already. We are just moving and observing or collecting. Here we can manipulate all the things, but the manipulation has to be done, or manipulation has to be written before your study starting. That is in the step in the protocol writing. You are writing all that things or explain everything. So this is the control meaning in this randomized control trial. So in experimental design, the researcher is an active agent rather than passive observer. In case control and cohort, the researcher is just an observer. The researcher has nothing to do, he is just collecting the data. Here he is an active agent. He can inject, he can give a capsule, he can give a chewing gum. That's what active meaning in this particular sentence. And experimental designs are concerned with examination of the effect of an independent variable on the dependent variable, where the independent variable is manipulated to treatment or intervention. Just now we told about giving an injection, giving an IV, or giving an intramuscular injection of an antibiotic, or any vaccine, or income which is given by this particular person. So that intervention will give you an independent and dependent benefit. That will be discussed in further steps. Coming to the history, as early as 15th century, the trials has been done in medical literature or medical practice. So there are that are all uncontrolled or they are not written for properly. So in last 2 centuries, this particular thing has established. So research or randomized control trials has been established. So one of the important thing is important trial is done by James Lind in 17th century. He examined the patients with scurvy on board, and the cases had similar findings. They stayed in one place and had one common diet. That's one important study which is there. And in 1943, the first double-blind controlled trial was done by Petroleum for common cold. 1946 was randomized curative trial, just done for streptomycin antibiotic. Coming to the steps in RCT, the first step is drawing up a protocol, selecting reference and experimental population. The main step or heart of this RCT is randomization. Then comes the manipulation and intervention, what we are going to give. Then comes the follow-up, what is outcome, and assessment of outcome, whether it is a negative or positive result. This is the step, and now we will go to each step in detail. Drawing up a protocol. Protocol writing is very important when we are going for a funding procedure. When we want to present it somewhere, we should write the protocol, especially for randomized control trial or experimental studies. Protocol writing is very important. So protocol writing, what we are going to do, how we are going to do, when you are going to do, who is going to do, all these questions has to be answered. And this has to be presented before an ethical clearance committee. Then only you can start the study. Otherwise, it is going to have some legal problems or ethical issues. So protocol writing is an art which you have to master. When you're going to anytime when you're going to do that, it's very important. Unless and until you have a protocol, you are not going to get an approval for your studies. So the first thing which has to be written in your protocol is aims and objectives of the study. What you are going to do. And if you are using a drug, what is your aim? That you are going for an antihypertensive drug. Hypertension is decreasing or increasing that particular drug. And any other complications which is coming, that will be your secondary variable. Other one will be your primary variable. So like that, you have to mention your aim and your objectives by number. Any number it can be your objective. You have to mention it in your protocol. And the questions to be answered. Just know where criteria for the selection of study and control groups. You have to put certain criteria before going for the study. Your study group what you select. You have to have certain criteria, certain age ranges. And there are so many. That's called as inclusion criteria and exclusion criteria. That depends upon the study which you are doing. And the size of the sample you have to mention before that. Sample instance, how many number you are going to select. That's what your sample is. And the procedure for allocation of subjects into study and control groups. How you are going to allocate them in study and control group. That's also very important. And treatments to be applied when, where, and how, and what kind of patients you are going to work. And standardization for procedures. You are not supposed to do according to your view. For a particular procedure, there is a standardized procedure or gold standard procedure which is there, particularly for surgery center. You have to do that for a particular group. And if you want to compare with any other new techniques, you have to compare with that particular gold standard technique. And for your technique also, you have to mention what is what you're going to do in the procedure also. So that particular person, scholar in that particular subject will review this your protocol. And only you are going to get your approval. And schedule time is also very important. and the responsibilities of the parties, the researchers who are doing, how many are there, and what are the responsibilities and children. So these are the things coming under protocol. It's full your blueprint or your script of what you're going to do in your next 1 year, 1 month, or 1 week, depends on your time. So after that, your next step is going to select the reference and experimental population. The reference population is also called as a target population. It's a population to which the findings of the trial, if found successful, are expected to be applicable. It can be a whole population, geographically limited, ethos, sex, occupation, social groups. An experimental or study population is a study population derived from the reference population. It should be randomly chosen from the reference population, and the participants are analyzed in the following 3 criteria. This experimental population should follow these 3 criteria or fulfill these criteria, then only they are eligible for the study. It should be representative of the population to which they belong. Like we are going to test a diabetic patient. Your study population should be a diabetic, or you are going to get drug on diabetic patients. That the population should be a diabetic patient, otherwise the study is not going to be correct, and should be qualified or eligible for the trial. And that this patient should not have any other medical complications, or our trial is going to harm him. We are not supposed to use them, and must give an informed consent. Is we believe consent should be taken beforehand from the participant. So next step is the main step called as randomization. It's called as the heart of the control trial. It's basically a statistical procedure by which the participants are allocated in groups, usually for a study and control, to receive or not to receive an experiment, preventive or therapeutic procedure, and intervention. It's a statistical procedure based on randomization. We have a target population or experimental population. We are going to divide them. How we are going to divide them? Nobody has a control in dividing this particular group. Then only it will be free of all biases. So for that, there are certain techniques for randomization. There are certain techniques. Usually nowadays, computer allocation or computer randomization is being done by many researchers. Because of easy accessibility and it's very fast and so lottery methods are there. And these are the techniques we use normally. So once you are done this, the examiner, and nobody knows, even the participants also doesn't know which group you are going to go. So it should be completely blinded. That is what is the important. And the main area here is the main aim of this particular procedure is to eliminate the confounding factor, because when you are putting them equally distributing equally into 2 groups, all that good and supporting variables or the negative variables, so these variables will distribute uniformly in 2 groups. The chances of error or chances of getting a good result is equally distributed in both. And randomization ensures that the investigator has no control over allocation of participants to a study for control. Thus, elimination what is known as selection bias. It is crucial that both groups should be aligned with regard to certain variables or characteristics that might affect the outcome of the experiment. So now I explained about that. Randomly allocating 2 groups will reduce a lot of biases. Once you are randomized into 2 groups, now comes your manipulation. Manipulation, as I told earlier, it can be a drug, it can be a vaccine, it can be a chewing gum, it can be a patch, or sticker, or anything. It can be. So we are going to intervene or manipulate this group by the deliberate application or withdrawal. Sometimes it can be withdrawal of an etiological factor also. When the suspected causal factor is the drug, vaccine, battery component, a habit as well down to the protocol. So this is what is called as manipulation. What happens when you manipulate? You are going to get 2 variables. So one is independent variable and the dependent variable. Whose effect can be determined. Independent variable is something whose effect can be determined. For example, vaccine. So the vaccine you are going to give in another 2 years or 3 years, you can see a decline in that particular disease in that particular area. So you can tell that incidence has been reduced. So that incidence what you are measuring, outcome is going to come is called your for a drug when you are either it can be a survival or recovery from that particular disease can be measured. So whether we are going to measure due to a independent variable, it's called as dependent variable. Independent variable is nothing but your outcome which can be measured. The independent variable is what the researcher is going to apply to that particular parts. This is clear. Then comes your follow-up. This implies examination of the experimental and control groups and subjects that define interval of time in the standard manner with equal intensity under the same given circumstances in the same time frame till final assessment. Follow-up may be short or may require many years depending upon the study or application. After you have done your manipulation, you have to wait for the result. So that waiting period is going to your follow-up. It can depends. It can range from a week to years. For some drugs, going for a antibiotic, it may show you your result in 7 to 10 days. So you just need a follow period of 2 weeks maximum. If you're going for a cancer drug or any other kind of drugs or vaccines, some vaccines when you're going to try, your follow period is going to be very fast because there will be a certain time period to get vaccinated and to get the result or incidence of the disease reduction, we have to have that particular period of time. So for that kind of things, it can take years also. So that is what is called as follow-up. The main thing is there is something called as loss to follow-up or accretion. This can happen in both your corporate studies and in your experimental studies. So when we are going for some long time or long period of studies, when we are waiting for a long follow-up time, there can be the patient can be removed from the study by various reasons. So the patient may die because he is an aged patient, or he can lose interest from that particular study. But any reasons you can just omit from that because from concept we are already taking. Anytime we can withdraw from that study. So that is what is called as follow-up, but it can drastically affect your result. Again, there are some technique for that in statistics to counteract this for loss of follow-up. That's beyond the scope of this particular class. We will be discussing about that. Yeah, come to the assessment. Once you finish your follow-up, you have measured your dependent variable. Then the other step is going to the assessment. Assessment is nothing but assessment of the outcome of the trial in terms of positive and negative. That is benefit of the experimental measures such as reduced incidence or severity of disease cost to the health services. The negative result is that is severity and frequency of side effects and complication in any death. So according to me, I can't just tell it's like a positive or a negative result. You are getting a negative result also. You are getting a side effect also. You are going to give an evidence to the outside world. Don't use this particular material. So that is not a negative result. It's a positive thing which we are sharing to the outside world. So there is nothing like positive result or negative result in terms of the outcome. When you are assessing, we can tell okay, this drug is not effective or not. It's going to make this complication. That can be considered as a step as a negative result. But as a sharing thing or as an evidence, that is not a negative. So that's what is an assessment. Then there are certain bias which can happen when we are doing an experimental research. That is something. One is subject variation. That is part of participants who may subjectively feel better or report improvement if they knew they were receiving a new treatment. Then comes the observer bias. Investigator may be influenced if he knows beforehand the particular procedure or therapy to the patient has been subjected. If the patient knows that he is in that particular study, he may give a positive result that he is recovering better. It's a psychological thing and it can affect our result. Similarly, observer also knows that this person is getting a good drug, a positive drug. We also, observer also unintentionally put some positive result to that particular subject. Then evaluation bias. An investigator may subconsciously give a favorable report of the outcome of the trial. The statistician who is doing this also can subconsciously affect that particular result. We may give it a positive or a negative result. So this is what is called as bias or variations which can happen in trials. And how to counteract this? There are techniques, something called as blinding. So in order to reduce these problems, a technique known as blinding is adopted to ensure that the outcome is assessed objectively. So first one is simple blinded. Participant is not aware whether he belongs to the study group or control. That is their subject variation they are doing this particular thing. And double blind, neither the doctor nor the participants are aware of the group allocation of treatment received. Third one is triple blind. Participant investigator principles and analyzing data are blind. At least double blinding has to be done in studies, which will improve your general validity of your studies. So, this is what is basically about randomized control trials. So, there are many randomized control trials happening. Intelligent 1,000 in one day or at a time, especially in this fast-growing things, drugs for cancer, drugs for HIV, now drugs for COVID also will be antiviral drugs also. Because of money is pumping to this particular area, particular pedagogical method, so randomized control trial. So this question is very, very important on the examination point of view. Say frequently asked essay question. I think it is clear from this side. And second question will be the types of classes that will be taken in classes.